On Wednesday the 19th of May this year, Edinburgh Napier University hosted People and Practice, a one-day conference where they celebrated all the people working throughout Scotland in the care home sector. It was a great day, with 8 skills-based workshops on, for example, managing delirium, pain assessment, inclusivity and staff well-being. Participants at the conference heard from frontline practitioners, for example physiotherapists, geriatricians and nurses, but most importantly, they also heard from frontline care staff who brought their lived experience to enhance the learning. Dr. Jane Douglas, the new Care Inspectorate's chief nurse, discussed the importance of seeing skills and recognising them, supporting their use and development, and strengthening the skills base of this sector. Professor Adam Gordon of Nottingham talked about the importance of interprofessional care teams. For this event, Edinburgh Napier University commissioned Mike Nicholson, an Edinburgh-based writer and social researcher, to write and tell a good news story as part of the celebrations. They wanted to tell the real care home stories of the pandemic, the stories behind the headlines, the real stories of living and working in care homes over the last year. Mike worked for many years in the third sector in a range of posts, with overseas volunteers, young homeless people, and then for 12 years running an information and training network for befriending projects throughout Scotland. For the last 10 years, he's worked as a consultant, undertaking research and evaluation across diverse projects, working with young people, carers, older people, people with mental health problems, and many others. Mike began writing in the early 2000s, and this became part of his work when his first children's novel, Catscape, won the Kelpies Prize in 2005. Since then, he has published a further 10 books, all for early years and primary-aged children. His 2 worlds of writing and social research come together on occasion when he's asked to write specific pieces for organisations or events, writing a book with and about single parents at Children in Scotland, or writing the diary of a young person affected by family imprisonment for families outside, or the personal stories of carers and their creative use of small respite grants. Please welcome Mike Nicholson with Here is the News.
Can you write a piece for us, they said. Help us tell the story of care homes. Write about the good things that have happened so we can celebrate stories which have gone unheard. Care homes, I said. The ones in the news? They are by our gloomy news. They're not sure if I can take much more of this news. Those care homes. Yeah, they said. Those care homes. So you mean the places where the reporter is suitably distanced and masked in front of some locked doors and talking to people through windows? Yeah, those places, they said. The care homes with the scary numbers, the fear of what's happening and what might come next. You want good news stories. Yeah, those care homes, they said. Well, I've not seen or heard a lot of good news in those reports, I said. Exactly, they said. So I began to think, to read, to ask, to listen, because beyond the grimness of all that news, there are other stories. Stories less known, stories that have gone unheard, behind the very same doors that appear over that masked reporter's shoulder. Untold tales underlying all of those daily numbers we got bombarded with. Those graphs with their fearsome spikes, where our eyes search for a more reassuring gradient. Forget those charts and the numbing 6-figure numbers, because beyond every single statistic, beyond those doors that we can't see past in a 3-minute news report, there's an industry of kindness and care for which there's no footage. Some small part of us, those of us on the outside of what's going on, do know there's a bigger story. Sometimes we've been pricked into a response. There was a time when we clapped on our doorsteps and banged our pots, some small recognition of the toil of others in circumstances we could hardly conceive of. But even this effort was sometimes badged as for the NHS. So as we stood, perhaps we thought of hospitals, wards, ambulances. We thought of nurses and doctors and paramedics, maybe GPs if they were lucky. But did we clap for care home staff? And even this was just a moment, wasn't it? A few weeks of Thursday evening togetherness. Then it went quietly back inside. Pots returned to the cupboard where they belonged. Banging pots on your doorstep. What were we thinking? We probably weren't thinking about care homes. We slipped away and left everyone to get on with it once again. To get on with what? What was going on behind those doors? Those of you working in care homes were doing what you had always done every day of the week. You were looking after people, making them comfortable. The clue's in the name. Care, home. But, and it was a big but, the goalposts had changed. Not just a shift of the goalposts. This was a new, bewildering sporting arena with endless complex and ever-changing rules. Goalposts moving, more like extreme Quidditch. The job descriptions you'd applied to do had whole new, unwritten sections. The place of work you'd been shown around on your first day in the job. So much had to change. The shared spaces, the staff rooms, the things people wore, who could go where and when. Everything revisited, reshaped, redefined. Doors closed, families barred, communal areas sealed off, music stopped, residents confined to rooms, friendships on hold. Everything interrupted. And what was there in place of all of these? The unsatisfactory rustle of plastic aprons, the slightly muffled voices and smiles made invisible behind masks, the fear of an invisible enemy, of what might come next, of the floodgates opening, of a ticking time bomb. Amidst it all, the guidance changing. You could finish your shift and come in the next day and have a whole new rule book to digest. Blink, it changed again. PPE, infection control, risk assessments, visitors, no visitors. Yes, visitors, but only outside. Safety huddle, data entry, oversight visits. Those writing and sending out the rules each time would have thought, job done. But interpreting them for each care home and implementing them was a whole other piece of work. And as the rules changed, the roles changed too. Care workers, feeling like prison officers as they closed doors on residents' rooms. A physiotherapist becoming a care worker, an activity coordinator, holding the hand of a resident in their last few hours. Students on placement becoming healthcare assistants on the steepest learning curve of their lives. Everyone becoming like family members in the absence of visitors. Everyone doing everything that needed to be done. Temperatures being taken, tests done again and again and again, cleaning, wiping, cleaning, wiping, wiping, cleaning. And then there was the job of supporting relatives, trying to connect them online or reassuring them on the phone, telling them their loved one wasn't alone, sometimes even in their last few hours. Don't worry, your mum has Helen with her, holding her hand. Oh, good. Mum really likes her. Your dad's comfortable. We've just put his Sinatra CD on for him. Thank you. That will make him happy. As the list of tasks grew, you were stretched way beyond what you were used to, perhaps beyond what you believed yourselves to be capable of, and working in a new reality where death had become so possible, some days so probable, and in some places so frequent. You didn't sign up for this, and yet you had, without realizing it. So you got on and did it, possibly not even knowing how much you were giving and learning as you went. And then, even when you'd clocked off, well, you hadn't really, had you? Because it's not that simple. Switching off from work became impossible. Worrying about what you might bring home, talking about work became harder to do. Dreaming about work became normal. So did waking up, thinking about it, and the tiredness that came from all of that. Not to mention, for some of you, time off actually meant that you took the lead on homeschooling. You became exhausted of being exhausted. As lots of other people adjusted to working from home or being furloughed, this was your new normal. I'm sorry. This was to be good news, wasn't it? But that's just the thing, that underneath all of this is the good news. Through all this time, you've clocked on for shifts and been there and brought care and kindness and love and companionship and friendship. And somehow, after the toughest year, in the toughest environment, publicised, scrutinised, politicised, you're still here. Months of immense challenge and hard graft, punctuated by fears and tears, yet you're still here. So here is the news, the good news. You're still here because you care. Still here because of how you feel about the people you care for. Still here because you know these residents intimately. Still here because this is what you do well. Still here despite everything thrown at you. Still here. So let's be still here right now. Let's be still here. For a moment, let's think about what you've done, the difference made, and who it was all for. You know their faces, you know the look in their eyes, you know the feel of their hands. They're not just some anonymous group, the frail elderly. They're mothers, fathers, sisters and brothers. They're aunts and uncles and grandparents. They're nanas and papas. You know them, your residents, your family away from your own family. They're Harry, or they might be Mary or Monique. Perhaps it was Eileen, who you helped to feed, or Norman, who you walked with in his room to keep him exercising. Maybe you brushed or cut Joyce or Rab's thinning hair. Was it Joan or Margaret, who you helped to wash after they had a bit of an accident? Could have been Betty, who you sang with, or Lucille, who you unwrapped her favourite toffees for. It was Doris, who you talked to about her family photos every day. Same photos, same conversation. It was Alice and Arthur, who you wrote letters with to the primary school children who'd sent cards. It was Jim and Stan and Isa, who all had birthdays, and you lit the candle on an individual cupcake. Maybe it was Peggy or Donald, who got especially agitated. Who are you? I want to go home. And you calmed them because it was you, it was your voice that they responded to. Your voice every day with Muriel or Frank as you said, good morning or good night. And it was all of them, for some with changing moods or appetites diminishing or bewilderment increasing with everything going on. It was every single one of them who you explained patiently to what was happening, sowing whatever seeds of reassurance you could, spreading calm. It wasn't easy, but it was necessary, and you did it. These are the moments, the conversations, the small actions, the relationships on which the real good news story is built. The story of continuing kindness and care, and of love, and of still being here. You being the light in dark times through the simplest and most personal of ways. So here are some new numbers, because I, for one, am tired of those daily figures on the news. Infections, hospital admissions, bed spaces filled in ITU, deaths, vaccinations. Cheerio. Let's have the 6 o'clock news or the 10 o'clock news or the whatever news marching to a different count. Let's have Hugh Edwards leaning casually on his desk as he does, announcing, in the last 24 hours, 825,332 care home staff exhibited exceptional levels of kindness. 1,649,212 care home staff showed extraordinary teamwork. 946,400 care home staff willingly stepped into roles they hadn't been expecting to do. 3,100 staff teams emerged more united and supportive of each other. 1,800,211 care home staff showed levels of love and commitment equivalent to some kind of superpower. The good news numbers. Teamwork, kindness, care, staying power in extraordinary times. Perhaps most extraordinary of all is how crazy all of this has been from how things used to be. I mean, since when was love expressed through double glazing? Since when were staff meetings held at a 2-metre distance? Since when did a wave from strangers passing the window become a highlight in a day? When you think about it, some of it has just been so ridiculous that there have even been laughs. After all the careful plans for outdoor visiting, you end up chasing after the new gazebo, which is blown down the street. Since when was chasing a gazebo in your job description? The exercise class, which still found a way to take place along the corridor with everyone seated in the open doorways of their rooms, reunited over a few leg lifts. Oh, look at you, your hair's getting long. What's that? I said your hair's getting long. Isn't everyone's? And then there was your patient explanation to Alice on a Zoom call with her family, but she kept looking over the top of the screen to find her relatives because she thought they must be behind the iPad. A year peppered with these moments of hilarity, moments of hysteria, moments of horror, but still some moments of hope. Through them all, you're still here. The good news story. You're it. The good news in care homes is you.